Think you are pregnant? Here are 10 early signs and symptoms of pregnancy. Thank you for your time. Please remember to like and subscribe. The earliest and most reliable indications of pregnancy in females with a regular monthly cycle include missing a period. This is when there has been no menstrual flow for 6 or more weeks following the beginning of the previous period. Medical terminology for this is amenorrhea. To make sure you didn't make a mistake or do something to confuse the date, it's best to wait a few days after you miss your period. For a precise diagnosis and to rule out other reasons of amenorrhea, including ovarian pituitary imbalance, emotional distress or stress, local infection, or acute illness, it's also crucial to perform a pregnancy test. Morning sickness. The majority of women have gastrointestinal, stomach and intestine discomfort, particularly in the morning, ranging from nausea and anorexia, loss of appetite, to frequent vomiting. This affects 50% of women starting in the 4th week and continuing through the 16th week. Often, it resembles retching more than actual vomiting. It can happen at any hour of the day. When excessive vomiting, also known as hyperemesis gravidarum, occurs, it's critical to notify the midwife or general practitioner to prevent electrolyte imbalance and dehydration. Breast changes. Your breasts become tender, swollen, and painful. There is a prickling, tingling sensation due to increased blood supply, particularly around the nipple, and this can be noticed as early as 3 to 4 weeks of pregnancy. Also, nipples and areolas become darker, and this effect is caused by pregnancy hormones. Excessive salivation, ptyalism. At around 8 weeks, there is an increase in the amount of saliva. Some women tend to spit out their saliva instead of swallowing it. Taste changes. Change of taste, which some women describe as metallic, while some described it as sour taste, and is most common during the first trimester and may last until delivery in some women. Regular urination. An increased urge to urinate first appears between 6 and 12 weeks into pregnancy, and it later reappears when the baby's weight puts pressure on the mother's bladder. Implantation bleeding. A tiny amount of vaginal blood is lost during the process of the fertilized ovum being inserted into the uterine lining, which causes the uterus outer lining to shed out and cause the blood loss. This blood loss frequently occurs during the woman's menstrual cycle, which makes it simple to confuse with a monthly period. The bleeding is thin, and the blood has a vivid crimson appearance. Additionally, the blood does not form clots and comes on around the anticipated menstrual cycle. Cramps. A painful, gradual, forcible muscle contraction that is uncontrollable. Cramping is one of the first indicators of pregnancy, much like breast discomfort. If cramps get strong, are felt just on one side, and are followed by bleeding, get in touch with your midwife or doctor right away. Fatigue. The pregnancy hormone progesterone is the source of this, which is noticed during the first few weeks of pregnancy as a perceived lack of energy. Fatigue results from the body having to work harder to support pregnancy-related changes. Heightened sense of smell. In the early weeks of pregnancy, the hormones estrogen and progesterone cause mild odor to become strong and unappealing, unlike before pregnancy. Please share a couple of the symptoms you noticed in the first few weeks of your pregnancy.